Christopher, you want to lead us in the Pledge of Allegiance, please? I don't know if we flag handy or what, but we'll figure it out.
Well, everyone, imagine that great flag. You join me. I pledge allegiance to the flag of the United States of America. I can't remember. There you go. Now you got me all going. Pledge allegiance to the flag of the United States of America. And it got me stuck, Ed. And to the republic for which it stands, one nation, under God, indivisible, and justice for all. Liberty and justice for all. Sorry, guys, I'm not fully awake yet.
That was most of the Pledge of Allegiance, so that'll work.
No, you caught me.
There she is. Madam Chair, I'll turn it over to you.
Thank you very much. My apologies. I was having technical issues this morning.
Yeah, we're on to roll call right now.
Okay, Madam Clerk, please take the roll.
Yes, Madam Chair, calling roll for the Community Homelessness Advisory Board for Monday, February 1st. Jardin?
Here.
Delgado?
Here.
Lawson?
Here.
Dare?
Here.
Hill?
Here.
Lucy is absent at this time, but it is my understanding he will be with us shortly. Madam Chair, you do have a quorum of the Community Homelessness Advisory Board agenda.
Thank you very much, and thank you for taking the roll. We're going to move quickly through this. We have a packed agenda, so we're going to try to get through these presentations as quickly as possible. And Arlo, when we get down to them, I may ask you if there's something you think we should shuffle around a bit just to make sure we make it through. This time, Madam Clerk, do we have any public comment?
Madam Chair, we do not have any public comment, general or otherwise. We'll transition to your next item, approval of your agenda.
Thank you very much. Does anybody have any items that they would like to move around or any issues with the agenda? Okay, seeing none, may I get a motion?
I'll move.
Second.
And a second. All those in favor say aye.
Aye.
Aye. Any opposed? Seeing none, motion carries unanimously. Item 5, approval of the minutes.
So move.
Second.
Motion and a second. All those in favor say aye.
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 Any opposed? Hearing none, motion carries unanimously. Okay, item 5, board update on Built for Zero. Dana, do I see you?
At this time, Madam Chair, I will move over Dana Searcy to be able to give you her brief presentation and update on Built for Zero. We will promote her to a panelist at this time. She'll be rejoining us and we'll be able to share her screen and advance her slides on her end.
Good morning, everyone. Thank you for having me, Dana Searcy, Washoe County Special Projects Manager. Since we last met, we have continued to build the foundation work, really this idea of having quality data that will inform our strategic direction for homelessness. The River Stewards program, as led by Grant Denton, has continued to see great success. We've updated our regional efforts to address homelessness matrix, which we will share with you today. And we have completed a substantial amount of the interviews for our community housing inventory for beds that are available. So I appreciate the magnitude of the agenda today, and we will move pretty quickly, but please feel free to stop me if you have any questions.
Dana?
Yes.
Dana, just for a second. I don't know, your microphone, is everybody else hearing? It's a little bit fuzzy.
Yeah, I'm hearing that.
Yeah, maybe we need to, I think everybody else is on mute, but just so you know, Dana, in case you might have a piece of paper or something that is brushing your microphone.
Interesting. Okay, let me know if it is continues to be bad, and maybe I'll try to switch. It's off of the computer, so.
Yeah, I think that might be it because it still sounds like there's TV static when you're talking.
Okay, give me 1 minute here.
We don't hear you at all, Dana.
Okay, let me know. Is that any better?
Not really, but just keep going.
Speak
We
less.
can hear you just a little bit.
We'll continue. Okay. Here's a look at our monthly reporting data. As a reminder, our actively homeless count is a reflection of the by name list. It includes people who've been actively enrolled in a program within the last 90 days. And we're still missing quite a bit of this information. As this does become more and more clear, we're being able to see that light at the end of the tunnel and preparing a plan of how we can fill in the missing information. This is a new graph that we've been able to put together for you and looks at the difference between unsheltered and sheltered populations. So of those included in our by name list, about 75% of the people are currently either sheltered in an emergency shelter or other temporary housing situation. And about 25 are unsheltered or have an unknown housing status.
Dana, would that mean, I mean, just number wise, so we're saying that we really probably only have more like 300 people that do not have a place, 300 to 400 people? Is that?
Yes, that are not currently sheltered. Now, I would add that, this number here, we're not exactly sure how accurate this is. That's part of what we're trying to do right now. A lot of the work that Grant Dunton is doing along the river and the other outreach teams are to truly canvass the entire area and find out how accurate this is and to fill in any missing names so that we have an accurate list of how many people are actually experiencing homelessness today and how many of those are truly unsheltered.
I appreciate that. Just because this kind of numbers do give hope that this is not something that we cannot tackle. I think we can get there. Thank you.
Sure. And then this is the final graph that we've been sharing with you, which is just our inflow and outflow over the month. We've continued to share progress updates of the phenomenal work being done by Grant Dunton through a collaborative project. We're seeing success in our new approach with our traditionally service-resistant individuals. Earlier, I mentioned that we have a plan to centralize the rest of that missing data from our by name list, and this is a really big piece of that project. Grant and his team have started to collect information on individuals that they're working with to help give light to that true unsheltered population. Also, as part of the Truckee River Fund grant, we've installed 2 needle collection containers, and the Karma Box project is providing educations about the importance of safely disposing of needles along the river. In the past, we've presented the idea that there are many different categories of work that must function in sync for us to be able to improve the effectiveness of our homeless system. And again, I know you all can't read this text, but you have the document that's shared with you and posted as an attachment in the meeting materials. This is our regional efforts to address homelessness matrix, previously presented in August and November to this board, and is intended to serve as a central resource, really as a summary of what's happening, who's doing what effort, who's leading it, where are the sticking points, and how can we support those items that are being evaluated. This is the same document that Assistant County Manager Kate Thomas shared with the Downtown Reno Partnership in August as a timeline. Chair Jarden, I know that you've requested this a few times. They are the same document. It's evolved quite a bit over the last 6 months, but they are one and the same. Currently, again, this document is serving as a summary of the work of projects that are ongoing, and it is really our hope that this would become a tool to prioritize efforts and ultimately develop into a strategic plan for homelessness in the region. And as always, I appreciate your feedback related to this document. I'm very pleased to announce that we've completed most of the interviews for our community housing inventory. The information that's been gathered will serve as an extremely valuable tool as we work to address homelessness. We've gathered information from each of the housing programs related to how many beds they have and the associated criteria. Our next steps will be to overlay our bed capacity with the details and demographics from our by name list so we can clearly see the needs in our community. This will allow us to address any specific gaps so we can and develop that plan to target the specific needs that still exist. And we will be bringing back this next month with specific data, and we will share everything with you. But today, excuse me, I wanted to share with you that I found it quite shocking over the last couple of weeks. We've put together over 350 empty beds in our community, which sounds like a lot, and it is. We can't answer why at this very moment. Most of those beds really do have criteria that are associated with them that make them maybe a little more difficult to house individuals in. Specifically, a lot of them are sobriety required beds. But when you look at having 350 current open beds and our number of about 300 unsheltered individuals in our community, the true goal of Built for Zero is to really figure out how do we bridge that gap and how do we make it more appropriate for people to fill those beds. So again, we'll be coming back with information, but it's enlightening and it's encouraging that there is some capacity. And then also finally, our monthly stakeholder meetings for Built for Zero will begin in February. We have been providing updates here at CHAB, and there are quite a few working groups that are meeting each week. However, we wanted to allow for feedback from the community to begin now that plans are in place and we have a better idea of what Built for Zero is all about. So that will start with our community program leaders and leaders across the community, and we're really looking forward to expanding the conversation. And finally, I received feedback this month that it would be helpful to you guys to hear more strategy and a little less data reporting from Built for Zero. We can absolutely bring strategy and best practice information. And we're not at the point really that we could back it up with real-time community data from our actual region, but we would appreciate knowing your preference and what would be most helpful to you, because we could go about this many different ways. As always, I appreciate your time today. Sorry about the static, and I'm happy to answer any questions.
Dana, thank you very much for that presentation. Static aside, thank you you always give such a great presentation, and you are correct that we have always emphasized the data, because all things will be data driven in the priorities and the things that we do here at the CHAB and take to our respective boards. But I do also recognize the need to kind of have a regional effort. And I know I've talked to Doug Thornley about this, about the communications to the community at large. While we may do the deep dives into the data and the numbers and that sort of thing, I think we do need to do a better job of collectively summarizing and presenting a presentation that the community at large can have to understand the things that we are collectively doing as a region, have done, are planning for, are doing, and will be doing in the future. I think these latest storms were a perfect example. The snowstorms were a perfect example of kind of that lack of there wasn't an easy place to point to say, here's all the things that we have prepared for winter sheltering and who's doing what, and where the community, I mean, there was some great community action that came forward to help some of our houseless individuals, but it seemed to be that there was a perception that there wasn't other things that were prepared for and being done. And that's our fault for not communicating as effectively as we can as a body and as a region. So we do need to work on that. And I think we need to put some efforts and energy into doing that. It's not on your shoulder, Dana. I'm just putting that out there in the universe that that's something we need to be working on, some sort of video and informational distributable marketing tool. I don't know if marketing is not the right word. Okay, Madam Clerk, can we get back to the screen? I don't think I can see everybody. There we are. Okay, any members? Mayor Lawson.
Yeah, so if I'm understanding this correctly, we have roughly 350 beds available, and we're roughly 325 people that are unsheltered. Is this the resistance to going into a program such as sobriety or drug recovery? Is that why we're seeing that gap? Dana, is that what you think, or?
Sure. Thank you, Mayor Lawson. I think that it, you know, we all appreciate it. We wish it was simple. It's not that simple. We have a lot of beds in our community that are seeing great success because they have that sobriety requirement as part of the program. And I think a lot of what we're going to see that we're going to need to address is projects that allow people who are currently living along the river or in an emergency shelter where maybe they're not so used to that structure and those rules. And we're putting them into a situation where they are surrounded with structure and rules. And there really isn't that bridge for that gap. You know, I think this is a lot of what you will hear is housing first from HUD is first get people sheltered, then get them stabilized, and then put them in an appropriate program that they can be successful in. And so, you know, is that a shift that we're going to see across our community? And again, I wish I had better answers for you. We are intending to come back after a full gap analysis and some statistical analysis to just really look at exactly where are the beds, what criteria is associated with them. There's some really large buckets, a couple big programs that have a lot of capacity. So why is that? And how can we maybe change our system a little bit to fill those beds a little more appropriately?
Thank you.
Yeah, and we know from the data we've collected and from just our own experiences that couples and pets, property, and partners are the three Ps that kind of are barriers for some of the entry to some of those, along with some of the resistance to the structures. So for sure, those are things we're looking at the Nevada Cares campus. Alexis, and then Member Dare.
Thank you, Madam Chair. And I'm so glad you pointed out couples, because that's what I'm hearing from RISE is that many couples were housed in this last community fund go around for motels, which I do also commend the community for coming together, but you know, we want to do better on the government side to see how we can support those efforts and show that we're, you know, really looking to house people. But for Dana's question about Built for Zero and what we're looking for presentation, I would really love a little bit more information on best practices. And perhaps this has been done to this group, and I'm sorry I'm new. So a little general overview of some best practices for our next call of, like, you know, do we combine services? Are safe camps a best practice? You know, what are communities doing that are really, you know, the gold standard? And again, if this has been covered, I can check it out offline, but thank you.
Thank you, and welcome. We're so glad to have you here. Welcome aboard. You're such a tremendous addition, and we're very glad to have you. Member Dare.
Yeah, just real quick. One of the things that we're seeing is we try to help people get out of this homeless situation. And I know that we have beds potentially, but we don't necessarily have a place to bring them outside of these, just staying at the shelter or doing whatever, because we're trying to find those places and it's been really difficult to find anything that is actually available. And so that would be probably one area of focus I'd be interested in, of seeing that next step. So we have potentially 300 to 400 beds, let's say, that we could get them in, but there are people there at the shelter, I believe, are ready to move forward, but the steps are very difficult to figure out how to get them on their own, or at least in a group setting and things like that. Sage Street is a great answer, but Sage Street requires a few things because of the grant that makes it difficult. And so, and I say that not putting it down, I get it, but the reality is I've been working, and there are people right now ready, and we keep having to say, well, we can't find a place yet for them. And then when it came to just presenting to us, I think part of the strategy part that would help also is just, as people are listening to this, how can anybody come alongside and help? Maybe we're not there yet, because I think that takes more organization to add people, but that's part of what I think the question a little bit is. The data is good, but is there anything that some of our community partners can start thinking about, because there's something they can go to and be a part of? So thank you for great work and focus, and having the data really is helping tons. Thank you.
Yes, thank you again. And I know, speaking of silos, which I know this group has worked really hard over the years to try to break those silos down. And I think the communication part is something we really need to work on, because I do know there are great organizations doing great work, but are they all kind of coordinating and communicating to understand where the deficits are so that the community at large can focus? And this last weekend was a perfect example of that, of an outreach, and folks came together and were very generous and got some of our houseless neighbors into motel rooms. And I know this board talked about that back in August of last year. And we did, as I recall, did some outreach to see if that was a possibility. And we didn't get, as I recall, the motels or hotels wanting to be party to that. So I don't know what changed and what the relationship is that Rise has with some of the hotels, but I commend the efforts that they did, and am proud of that work, and want to see how that's a piece of the private sector and the volunteers that connects with the public sector's work as we move forward, and see that all of these successful campuses are funded a third by the private sector. And anyway, we'll get to that as we move forward with some of the fundraising discussions. Any members have any further questions or comments at this time? Okay, seeing none, we are moving on to, Madam Clerk, was there any public comment on that item?
There was none, Madam Chair.
Thank you very much. Moving on to item 7, presentation and discussion on law enforcement related to encampments along the Truckee.
At this time, we have deputy chiefs from all 3 agencies available for their brief presentation.
All right, you're up.
Morning, Chief Deputy Greg Herrera, Washington County Sheriff's Office, for the record. And was our presentation going to come up, or did we need to share that? Because we had sent it in and thought it was going to be showing up on for us.
The clerk can probably pull that up for you. You'll just have to advise when to.
I would appreciate that greatly if we could, please.
Herrera has a tough time running a computer anyways.
Yeah, Madam Chair, I was going to tell you, I don't have those skills, so I apologize.
Little IT.
That's okay.
Thank you, Commissioner Lucy.
You're welcome, buddy. That's what I'm
Our
here for.
clerk will pull that up for you.
I appreciate it.
All right, just waiting for the download to come through on my end.
Can we do quick introductions while she's pulling this up?
Absolutely. Again, Greg Herrera, Chief Deputy with the Sheriff's Office, in the room with me. Deputy Chief Ollie Miller from the Reno Police Department.
Morning, everyone.
Deputy Chief Clint Bellamy from the Sparks Police Department.
Good morning.
Lieutenant John Galicia from the University of Nevada Police Services.
Good morning, everyone.
Also present in the room, but not presenting in the back, is Chief Deputy Jeff Clark.
Wonderful, welcome, and we've got it up on the screen.
All right, so good morning, Madam Chair and members of the board, and thank you for the opportunity to present to you today. I'll skip my introduction portion here since we just did that. I just want to start with, I recently had a conversation with 2 of our supervisors here at the Sheriff's Office who were interested in leading our homelessness outreach team. During that conversation, I told them that in my almost 28 years of service, I can't think of a more important and challenging issue that we faced in our community. An issue that's not going to get any better until we all focus our attention, resources, and problem-solving skills at this ongoing issue. Madam Chair and members of the board, this obviously isn't our first time before you to provide updates. We also understand there's been some frustrations on your part about either the perceived lack of coordinated efforts from law enforcement in the region. We certainly understand the need to enhance our communication, and we are all committed to coordinating our efforts so that we are addressing problems in an effective manner, not simply just pushing problems from one location to another. As a result, we've been meeting on a continuous basis since December to make sure that this occurs. We also understand that we as law enforcement are only a piece of the puzzle helping improve this problem. We are all here committed to working together, along with the vast number of community partners in the region. We're also working towards the same goal. Next slide, please. Actually, during this presentation, we'll be providing a brief overview of each law enforcement agency programs and assigned personnel, our outreach efforts, and then the next steps. Next slide.
Good morning, Deputy Chief Clint Bellamy for the record. As you may remember, on November 18th of 2020, Sparks Police Chief Chris Crawford and Sergeant John Vasquez presented a comprehensive overview of the Sparks Police Department's homeless outreach proactive engagement team. In the interest of time, I will share a brief summary of the Sparks Police Department HOPE team and just go over some of our success. The Sparks Police Department has 3 full-time officers assigned to the Homeless Outreach Proactive Engagement, or HOPE team. The main goal of the HOPE team is to offer services and assist those experiencing homelessness. They work with various organizations and charities to help those in need with such things as affordable housing, shelter, space, food, clothing, and obtaining identification and social security cards. The HOPE officers create a rapport and provide empathy, support, and resources to those experiencing homelessness. Next slide, please.
Chief Deputy Greg Herrera again for the record. Through the manager's office, we're proud to state that we received funding for 3 additional personnel, 1 or 2 deputy sheriffs and 1 sergeant. We'd hope to have that team stood up by this time, but unfortunately, due to abundance of retirements, we are pushing towards July of 2021. We're currently in the process of selecting those team members. So I'd like to thank in advance Dana Searcy from Built for Zero and the supervisors from Sparks Hope for helping us make those selections here in the forthcoming weeks. Once that team is stood up, I'm very proud to announce that they'll be training and working with the Sparks Police Department Hope's team. Next slide. And along with working with the Sparks Police Hope team, they'll also be collaborating with the Reno Police Department and other law enforcement partners in the region. This team will also work closely with Built for Zero to eliminate the duplication of efforts and access to numerous resources available in our community that assist with transitional housing, food, shelter, clothing, medical and mental health needs, employment, reunification of family. I just mentioned a few. This team will also continue to work closely with personnel from the Washoe County Sheriff's Office Detention Services Unit, which offers services to persons in our community who, upon release from the detention facility, require assistance with such things such as mental health care, prescription medication, and other resources that aid in preventing them from experiencing or re-experiencing homelessness. Our philosophy will be continue to identify each person in our community who is experiencing homelessness and get to know them by name, build rapport, and offer outreach and services based upon their individual needs. Next slide.
All right, good morning, everyone. Ollie Miller, Deputy Chief of the Reno Police Department for the record. I wanted to give a brief overview of our Clean and Safe team and our homeless outreach team that's attached to that. The Reno City Manager's Office launched the Clean and Safe team in January of 2020. This team essentially addresses homelessness and those living in homelessness conditions, and it's really a way of offering the support to those who need public health and welfare of those living in the encampments along the river and other areas within Reno's jurisdiction. The Clean and Safe team is comprised of a program manager, personnel from the Reno Police Department, our mobile outreach and safety team, Public Works, Parks and Rec, and the Reno Fire Department, all coordinated through our city manager's office. This multidisciplinary partnership enables us to provide outreach, resources, and enforcement actions to address the health and public safety of those affected by homelessness. Next slide, please. Our community action officers assigned to our team essentially work 7 days a week, meeting with those experiencing homelessness. Their goal is to connect people to resources, which include local advocacy groups, charities, shelters, addiction services, and mental health counseling. Currently, the homeless outreach team consists of 4 full-time community action officers and 1 team sergeant. Our homeless outreach officers work in conjunction with most, our downtown ambassadors, veteran services, and community advocates to connect those in need with those services. That's our entire goal. On average, our homeless outreach team meets with about 75 to 100 unsheltered residents every single week. And I think very much like Mayor Lawson brought up and Dana Searcy described, only a small percentage accept those services, and even an even smaller percentage stay connected with those services after they accept them. So we're still working through, really trying to anchor our community members to services that are homeless. Next slide.
Morning, everybody. Lieutenant John Galicia with the University Police Services. Historically, our Nevada system higher education properties have been located within close proximities of our homeless populations, to include our main campus. Some of the others I have listed here, Sparks Farm and others throughout the region, both in the city of Reno and the city of Sparks. Our approach, though, because it's not as big of an issue for us, we don't have anyone specifically assigned currently to handle the homeless population. So our approach is going to be creating a part-time team made of 2 patrol officers. Oh, sorry, can I get next slide, please? 2 patrol officers designated to focus on our NC specific issues, as well as a lieutenant overseeing that. Eventually, we'd like to see a sergeant oversee this team once we're able to fill some vacancies. And then we also currently have 2 UNR social work students participating in an internship with us who are also going to be part of the team as well. Next slide, please.
As far as our interagency outreach, the executive command and first line supervisors have been meeting since last December to determine best practices moving forward. By pooling our resources, it will allow our individual agencies to work together with all of the benefits of a regional team. Each partnering law enforcement agency can stay focused on their jurisdictions while exploring opportunities to work jointly on major projects. So the weekly meetings right now are, as I said, for supervisors. The monthly meetings will be the command staff, the gentleman you see here in this room, to brief on any upcoming projects, any operations, and just a sharing of information, which we haven't been doing, which we see now is critical to this process moving forward.
Reintroduce yourself for the record.
And for the record, I apologize, Deputy Chief Clint Bellamy, Sparks Police Department. Next slide, please.
All right. Deputy Chief Ollie Miller, Reno Police Department, for the record. I wanted to take a moment to cover some of our next steps. I think you heard Chief Deputy Herrera already speak to it, but I wanted to reiterate our commitment to improving our communication. And that has to happen within all levels of each one of our individual agencies. We can't continue to push this homeless issue around from jurisdiction to jurisdiction. It's a waste of time and resources for our communities, and it's a disservice to those individuals experiencing homelessness. We can improve our service capability to this community by having frequent planning discussions like Chief Bellamy just discussed in advance of the opening of the CARES campus. And this will help us to ensure that we're moving this population into services instead of the city streets, parks, plazas, and other dead spaces here within the Truckee Meadows community. Our line level staff has been evaluating some of the statistics we track, the frequency in which we track them, as well as other areas of interest to get a baseline of exactly where we are all at as individual organizations. The goal is for our personnel to communicate with one another so that we have an idea of how many unhoused residents we have in the region compared to the bed space availability and other factors that will help us with our outreach efforts in this community. We are looking forward to providing an update to this body to let you know how it's going in the next several months, probably sometime this summer, and we'll get on the schedule for that. Next slide, please. With that being said, this concludes our presentation, and we'd like to open it up to the body to ask us any questions that you might have.
Thank you very much. We're going to go to Member Lawson and then Member Dare.
So I think the first thing that comes to mind for me is, do we have a central data collection point that we're going to look at? Obviously, it doesn't do any good for you guys to make contact and we don't know what's going on in Sparks and vice versa. So that, we have the same person under the same name, we know what their issues are, and we're not duplicating the process.
Mr. Mayor, you're absolutely right. When we came together in December, we were all measuring different data points, and what we're really looking at is a real true comparison, apples to apples. As a matter of fact, starting in last December, we actually started sharing all the information that we've been gathering. How many individuals have we encountered? How many of those accepted outreach? Where some of our larger encampments are, areas of interest, and some of the issues that we've been having in coordinating. I know that City of Sparks has a really slick system with regard to how that data collection goes that can be processed over a smartphone directly into the field, thereby taking away some of the paper entries that we've been looking at currently. So we're working through that, but that's one of the areas where we need to gain more consistency. We're comparing a lot of the same things and trying to bring that information together in one document.
Good, I'm glad to hear that. The other part of that question is too, have we thought about making this a regional unit similar to the gang unit or other emergency response type units we use regionally?
We absolutely have, Mr. Mayor, and quite frankly, we don't know what we don't know about this process yet. One of the things that we considered, and we considered a whole bunch in our last 6 or 7 meetings since the CHAB that occurred in November, is that we wanted to ensure that we could remain responsive to the individual jurisdictions that comprise this team. I don't want to pull away everyone to work on something that might be emergent in our community, the city of Reno, while there's something emergent happening elsewhere. We want to be able to coordinate, but not take away someone's resources that they might need right now. So what we're looking at doing is bringing everything together, working together, having our teams, work on joint operations, collect data the same way, to figure out what it would take to create a regional team, but we're not quite there yet. We've determined that working collaboratively, working in unison, moving forward might be the best next step and best practice for now until we can figure out what we all need as a region.
Very good, thank you.
And one thing I would add to that, sir, is we do have our regional goal. We might not have a regional team right now, but we have regional goals in addressing this homelessness crisis.
Member Dare.
Yeah, thank you guys. I really do, and gals, I'm not sure who I was there, but I just really want to thank you. We've been talking about this for a number of years of how important this can be. One of the things, the date of July got thrown out there, and what I'd asked for a little bit of a commitment, and I say this just because we're all in government. We watch how this happens. We come up with plans, and we try to answer as many questions as we can that we don't know, as you mentioned. We don't. Sometimes we just sit and watch because we don't have that answer. I'm going to ask that we don't stop and just look for answers. Let's just move forward. And I say that we're not going to hurt people by moving forward. We're going to be able to see things clearer as we get closer to it. So I really do believe if you guys would just take, I mean, July, I get it. You guys had that. You guys are ramping up. Some sort of that date could help. And then yes, this thing will need to be tweaked. But we've seen even recently some regional problems because we weren't working together. And I won't go into them, but I'll tell you, in my opinion, I think we could have avoided some of the things that we just saw. And so it becomes more and more important that this is not just ongoing and we don't go, well, we'll get to it in December. We'll get to it. We can't do that anymore. We are all moving together. And truthfully, it's in your hands. All we can do is ask for it, and then you guys do this. But I'm really asking that hopefully by July, we really are moving forward, even if it's 1 step, 2 steps. Maybe there's 10 steps in this whole process, but let's do 1 or 2 and at least get to that place. And maybe you're saying the same exact thing, but for me, sometimes it's a little frustrating to watch us in the inactivity of things we keep talking about. And I'm hoping that we can move forward. Thanks. Appreciate you guys tons.
If I could respond to that, Deputy Chief Bellamy, for the record. Sir, that's exactly what we are doing. We have our lieutenants meeting on a weekly basis. We're sharing those raw data points, and we're just having that constant open communication, which is what we lacked in the past. And I agree, we're lucky in this region that we have had a great amount of success with some of our other regional units. But with this constantly moving fluid situation that we're faced with, we don't want to rush into anything, because I think if we do, we're going to wind up neglecting each of our individual communities. So by sharing this information, we will continue to move forward. And hopefully by July, we're at a point where we can make additional steps, but we're not stopping this forward momentum. Great things are happening, and we're seeing it by from the command staff down to our lowest line level officers. So even early on, we like what we're seeing, so we're going to continue to improve upon that.
Thank you for that commitment. Appreciate you, Kurt.
Yes, thank you. That is tremendous. I know this is something we've talked about for quite some time, and I'm very encouraged to see that you've been meeting not only monthly, but on a weekly basis as well. And I know you had to come together as a command staff to sort of lay the framework to begin this process of communication and coordination and collaboration for this effort. And my next question is, and I know we talked about this, I think back in December, was now that this is kind of getting the structure to it, at what point do you begin to bring in some of the entities and advocacy groups that will be part of these efforts? And what I'm getting at is, when the Nevada Cares campus opens, there's going to be, a shift in locations for individuals to be, and, giving ample notice and facilitation of those sorts of things is going to be a united effort. And like, when have you been meeting with MOST and HOPE and the Karma Box Project and RISE and BOA and Built for Zero and the county outreach folks, so that we're all kind of singing from the same hymnal and everybody's kind of getting the same information so that we can plan accordingly for when Nevada Cares campus opens?
The Chief Ollie Miller, for the record. To answer your question, we absolutely have, ma'am. We are looking at, right now we're we're outreach to everyone. We don't have a facility that, will accommodate everyone currently, but to coincide with the opening of the Nevada Cares campus, we absolutely as a region plan on enforcement activities. And that takes a lot of outreach on the front side, a lot of communicating with our advocate and activist groups that are out there, and a lot of notice to those individuals living in homeless circumstances. So to answer your question, yes, that's already begun. And, you know, I will give you an example. We have a heavy outreach push that is going to have to occur underneath the Wells overpass. We have a lot of our community members living under that overpass in difficult circumstances that, you know, we've been trying to outreach to. And it's going to take a big regional effort. And I've received the commitment from the individual law enforcement leaders in this room and their agency heads for assistance there. You know, just like we are offering our assistance to any large encampments that are outside of the city of Reno, we're really looking to have the opportunity to work together on these large scale outreach and enforcement operations that we'll all be conducting between March 15 and, you know, summertime. They're going to be extensive and the work's already begun.
Thank you very much. And I appreciate
Madam
that.
Chair, if I could just add to that, I apologize, Greg Carrera for the record. Along with that, we've also handed down, make sure that we've had representation at the Built for Zero meetings to make sure that we are in lockstep with community partners and we understand resources. We recently had a couple of joint meetings with Dana Searcy about this, just to make sure that we're on the same page moving forward, and that local law enforcement are definitely a part of that.
Thank you. Thank you very much. And I know a lot of this is tied to the opening of the Nevada Cares campus, and with any construction project, that's not a finite, you know, sort of date that we can totally lock down right now, which is a variable that we have to stay kind of fluid with. And I'm hoping Arlo's bringing me good news when he has his update on that project. All right. Do any members have any additional questions or comments? Okay. Seeing none, thank you for your presentation, and would certainly like to have a presentation like this as an update at every CHAB meeting for the foreseeable future, just to kind of give us a, you know, a snapshot of what's happening, what's being planned, what you're seeing out there. Your guys' involvement is so incredibly important, and we thank you very much for coming together. This is a big deal, and you're a huge part of it. So thank you for all your efforts in that regard.
Thank you.
Thank you.
All right, we are on to item 8, board update and discussion on Nevada Cares campus. Arlo.
Good morning, board members. Excuse me. For the record, Arlo Stockham, City of Reno. I have a quick update. I don't have a slide deck, just a verbal update on construction at the Cares campus. Both the immediate work and some additional discussions that have started for phase 2 work. For the project currently under construction that was jointly funded at your joint meeting, everything's been going pretty well. However, last week did throw us for a loop with the weather. We were scheduled to be pouring concrete today, and we got delayed at least a week due to the weather. So it's going to be, it always has been a very ambitious construction schedule to hit that March 15th deadline, and it did get more ambitious with the weather we've had. Q&D is the primary contractor out there. They're as good as anyone at pulling this stuff together. So the whole team is trying to expedite, clear some snow, get it so we can pour concrete soon, probably next week. We're scheduled to have the structure delivered in 2 weeks from today and start going vertical. But again, it's going to be very tight for March 15th. It could well stretch into late March, kind of depending how the weather goes and how quickly they're able to recover from the storms last week. So that being said, we have also started discussions on future improvements. As I'm sure everyone recalls, the budget was limited, and the shelter is a good solid structure, but it doesn't have a lot of the bells and whistles that we would like to have at the Cares campus. So we've had a couple initial meetings, and we're planning some more, including outreach to all the different organizations and individuals who are interested in contributing both ideas and efforts. What we're looking at is coming up with a phase 2 improvement plan and then trying to fund it through a combination of government and private contributions. The initial list for that phase 2 suite of improvements would include a meal service, a cafeteria, and laundry, likely with a commercial kitchen. We really don't have any kitchen or food facilities over there. Catholic Charities is picking up and delivering, and we would like to get that going. The second component would be what we're calling a resource center, where we would have an intake desk, offices / facilities. We would have additional office and desk space for service providers to utilize, and some improved secure storage. And then the additional improvements, later on your agenda, discussion of a campground, a sanctioned campground, and potentially an RV parking area, which is kind of a gap we have in our plans right now. By our estimates, there are about 100 people throughout Reno living in RVs, moving from place to place. And if we had a sanctioned area where people could park RVs and stay, we think that would be a big improvement. So those are all very preliminary topics. We have outreach meetings both with a fundraising group, and we've got folks like EDON and others volunteering to help with the fundraising, but also outreach to the service providers and interest groups. I think we have a meeting getting scheduled, if it hasn't already, for next week to kind of review that preliminary list of improvements and get feedback on that. So that's my quick update for today. Happy to answer any questions that you may have.
Arlo, can you, I know we had a kind of a kickoff fundraising meeting with a number of folks, managers and EDON and Chris Askin with the Community Foundation, and kind of started to get some of the bones of the private sector fundraising going for some of the things you spoke about. And I know we're going to be talking about the RFP. I don't know if it's today or at the next meeting about for the operations of the Nevada Cares campus. But can you talk about what things the CARES Act funding afforded us? In other words, we knew going into this 46,000 square foot structure, some of the things that we were going to need to have right out the gate and what qualified for spending. I think some storage lockers, dog kennels, that sort of thing. Can you touch on that quickly?
Sure. So the funded improvements, we have the 46,000 square foot shelter and site improvements, paving, outdoor areas, some shade, some landscaping. Within the shelter structure, we've extended full utilities so it can be improved later on. We have extensive electricity throughout. We have water and sewer pretty much on the north end, but we don't have a lot of interior improvements. We have a few walls, so there'll be separate rooms. We'll have a room where pets can stay, and we have some kennels as part of the budget. We'll have a room where couples can stay, and then a larger general sheltered space for the men. We do have in the budget to increase our bed supply to 450, as well as 450 combination lockers. We're also using the old, it's basically a storage building, kind of a small warehouse that's there. It's pretty beat up, but it's good enough for out of the weather storage. So we're using that for storage of belongings and kind of have a secured bike parking area there as well. But beyond that, there's not a lot else. There's no offices. There are a few washer and dryer machines, mainly for the linens, but we don't have, laundry services for people staying there. It's a flexible interior space, so we can set up tables for eating, but we don't have a dedicated cafeteria. So kind of those additional improvements that are geared towards making it more attractive and desirable for people to use that site. That's really the focus of phase 2. Thank
you, Arlo. And the fundraising meeting that Alexis, I know you were in that with me as well, was, the need to kind of start really nailing down, what those necessary items are, and having the meeting. I think it might be mid-February, Arlo, that we're going to have the meeting with a number of the stakeholders and get some of the best practices as to the things that really do need to be, but haven't been funded to this point in the Nevada Cares campus, and how we can best get to that. You know, the couples and the pets and the, you know, I'd love to have community court there. We'd love to be able to have a DMV satellite location. I mean, all those things that, you know, and I know some of it might be a little bit of a Christmas wish list, but I think it's important to communicate with the experts and those on the ground that have the best input, and really start building this as best we can, and communicating that to the private sector who really do want to help. We just need to present them with what the needs are and how they can be a part of that. So thank you for all of your work on that. Member Lawson.
Are we looking at the private sector to provide some of these services? You know, coin operated laundry comes to mind just as an example. Some of the other things. I mean, I don't think we should do everything for free. I think there has to be a cost to the person, because if it's just free, then you don't appreciate it. But I'm encouraging that we look at those services, even as much as storage and everything else, as we look to the outside, to where there's maybe a business opportunity or donation opportunity, somebody who does it for a living.
I think that's great suggestions. And I know that a number of folks have been, the county and others have been meeting with some of the service providers of some of these campuses and getting some of the information. And I think we've got a presentation here coming up shortly to kind of understand how those best operate, and the understanding that, you know, on average, a third of the funding of these campuses comes from the private sector. And we need to definitely tap into that if we're going to be successful. So Arlo, thank you for all your work on this. Please keep us updated on the construction schedule and Q&D. Come on, Q&D. Member Dare, did you have a question?
Just real quick, this has to do with the caseworker load that's going to be coming, and I know we're focused over here and we're agendized for construction. However, the problem is if we get that done and we don't have all the caseworkers in place, and maybe this isn't the time for that conversation, but I do think should be something that we do spend some time talking about, because it will do no good to do all this without having that infrastructure. And so if there could be a time, maybe, I don't know if it's a planned part already.
Absolutely. If I could maybe respond to that, that is critical. We did re-up the VOA contract with increased caseworkers. We also have contracted a bunch of money, both towards our internal staff and the Karma Box project, to the tune of about $250,000 to help with those types of services. And that's been working pretty well along the river. In terms of future operations, you know, our operating agreement expires at the end of June. And I think this group needs to be involved between now and then at the operating agreements for future years and moving forward, both with case management and all the other services that are needed. That was part of the discussion in our fundraising meeting, that anyone who's going to contribute to this facility is going to want to see a commitment from the local governments to operate it for a prolonged period of time. And those enhanced services are really going to be necessary to get good results.
Yeah. Chris Askin with the Community Foundation, who I would say is a master of and understands fundraising probably better than anybody, made that crystal clear that the private sector contributions, particularly from foundations or large donors, that's going to be their first question is, you know, I don't want to sponsor a, you know, $250,000 laundry room or kitchen when there's not operating structure and commitments. You know, they don't want to see those investments fall if those structures aren't in place. So I suspect we'll be having these discussions on probably our next meeting agenda to get a better idea of what that looks like. So, all right, Arlo, did you have anything else? Okay, thank you, appreciate that. All right, we're going to move on to a presentation by, I hope I'm not mispronouncing this, Mesilla Valley Community of Hope's Camp Hope. Madam Clerk, I'm assuming you're moving someone over.
Yes, Madam Chair, I will be moving over Nicole Martinez at this time. She will join us as a panelist. And Nicole, you're unmuted live on our end. You may proceed with your presentation.
Great, thank you so much. You did pronounce that correctly. It is the Mesilla Valley Community of Hope. And I am going to go ahead and share my slides. You guys have been on for quite some time, so I'm going to try to run through this for you pretty quickly. So I'm here in Las Cruces, New Mexico, and the agency that I work for is the Mesilla Valley Community of Hope. I'm going to be talking to you today about Camp Hope, which is a tent city that we have here that our city council did approve in 2011. So the Community of Hope has been around since the 90s, and originally we were a day shelter serving people experiencing homelessness. We're on a campus of agencies, and so we're all on city property. We had city council legislative funding that helped us to build what we call is a campus of agencies or an alliance of agencies. So the city owns all of this land and we occupy it and provide services for people experiencing homelessness, indigent, disabled folks. We have our agency as the leaseholder. The other agencies sublet from us. We have a healthcare clinic, a soup kitchen, a daycare for homeless and near homeless children, a food pantry, and then our parent organization, the Mesilla Valley Community of Hope. And then to our west, we have Camp Hope, which again became a program in 2011. We also began branching out from being a homeless shelter to providing housing services. So we have several different types of housing programs, over 500 vouchers, rental assistance through HUD Continuum of Care, Emergency Solutions Grant, city funding, and we own a few homes as well. So here are just some of the services, again, reiterating what I discussed. We also have a day labor program for folks and representatives who help apply for disability benefits through the Social Security Administrative Program. So in 2011, we started Camp Hope as a response to the lack of housing vouchers that we had here in our community. We do have one overnight shelter, the Gospel Rescue Mission. For a variety of reasons, many of our clients are not able to stay at that shelter that is privately run. We also have a domestic violence shelter, but we have almost 3,000 people experiencing homelessness within a year. And so if we're only serving about 500 and some with vouchers, you can see that there is a gap. So we had a lot of people that were sleeping on our campus, and the city of Las Cruces did not like that because camping is not an allowable activity on their property. And so we got together with several of the residents who were sleeping outside and asked what a solution might be. And they came up with perhaps starting a tent city that would just start as a 3-month trial process. We went to city council because there was no other alternative at the time to doing a tent city. We were not prepared to build a brick and mortar shelter. We were more actively engaged in housing people. They said, okay, we can go ahead and do this for 3 months to get people through the winter and then try to figure out a longer term solution. So we brought in a mediator and he provided what we called great conversations. And those are just really solution focused, trauma informed, kind of talk about the experience people are having on the streets and how to move into a tent city. We did receive municipal support to rezone the property to allow the tent city. And so we zoned it as a planned unit development to allow for camping on city property. After the 3 months, we found that we were really effectively housing people faster and more streamlined than we had before. In the past, we were driving to the Rio Grande, trying to find out where homeless encampments were, where the clients were for their either Social Security appointment or their next housing appointment. This put everybody in our backyard. One of the main things that helped us with that is because we already had that infrastructure in place. Things like bathrooms are really important, storage, managing donations, those kinds of things. And so we were able to take that on through our agency and add insurance and more safety and security to the property. It was something that we took on feeling like it was a gap in our community. There were homeless encampments anyway. And so we felt like this was a good alternative to making sure that they were regulated and sanctioned. So we had 3 of the leaders go to city council and advocate for that. We made up agreements with policies and procedures. Of course, we utilized some of the input from those who are experiencing homelessness. And we met with our emergency responders, fire department, law enforcement. What would they like to see as we began to consider having an actual camp on our property? And they really helped us to outline our final site plan for that rezoning. We also met with our surrounding business partners. What were their fears, concerns that they might have? We did have some, not in my backyard, of course, but the thing was people were already in their backyard without any kind of regulation or supervision. We showed that it was better to have people sleeping on our property than to have them sleeping on their property or in our downtown Main Street behind businesses. The camp residents then began to regulate each other. We did a comparison on our police reports of the year before we had the camp and the year after, and we found that our police calls increased significantly. And I was really concerned about that, and I got records of it and I went through, and what I found was that the camp residents were calling often on people who were trying to break into the camp. They also were calling a lot more often on their peers who were having crises, mental health crises, so things like suicidal behaviors and tendencies. It wasn't an increase in crime calls. So what that told us is we needed to do a little more training on when it's appropriate to call the police and when it's appropriate to call staff or a mobile crisis therapy response instead. We helped train our staff, our client residents with incident reports, doing rounds around all of the campus. So we got buy-in from all of the agencies here. And then all of the agencies here, we all pitch in together to pay for paid security. Our security, we have an officer here during the day from 10 to 3, and then they're gone. And then a night security checks in 3 times during the night. The main security is from the residents themselves. They do security shifts, and that was one of the agreements that we came up with our emergency responders, that we would always have somebody on duty 24/7. But this really helps the camp to be autonomous. They are doing a lot of that regulation. We do have a camera at the camp and a few other places in our surrounding area, but for the most part, they are doing the rounds, they are checking in, and we have a schedule to see who is on duty at any given time. Our camp is capped at 50 people. The city of Las Cruces did give us a one-time startup boost of about $10,000 that helped us to buy tents, sleeping bags, pay for porta potties. We have since graduated from porta potties, and we have actual bathrooms with showers and an outdoor kitchen. We partner with a lot of local clubs, businesses to bring our camp up to code. A lot of churches, Eagle Scout projects, as I'm sure you can imagine. We use the Bureau of Reclamation best practices for camping. So we put up these tent pad sites to make sure that all sites were elevated, that drainage was sufficient, that people with disabilities would be able to access the tent camp sites. We do have a camp manager, and that manager is a client, somebody who resides at Camp Hope. Our current camp manager has been here for 2 years. They are approved by our Community of Hope staff. We provide walkie-talkies at the camp office and with Community of Hope staff. And the camp manager does sign a memorandum of understanding and responsibilities. The incentive to be the camp manager, because it's a lot of work, is we provide gift cards to the camp manager throughout the month. We do have a full-time staff person at Camp Hope who is there Monday through Friday, 8 to 5. And it is because we are a HUD grant recipient for coordinated entry, which helps us to provide outreach and do coordinated entries, the surveys to rank people for homelessness to get into housing. And that allows me to have that funded position there at the camp. And at this time with the 50 people, that's really sufficient. We also have light touches from a lot of the other caseworkers. So as my staff person refers somebody to housing, then my housing case managers kick in as well. So they've got eyes on the camp as often as they need to as well. We also utilize a lot of interns through the social work department and the public health department to help us with the camp. So residents, when they're coming in, they register for the camp. We do not have a waiting list. We did in the beginning, but ultimately we ended up housing so many people, we didn't need to have a waiting list anymore. And those are just sort of hard to manage. The camp is low barrier entry. So we use a harm reduction model. We do have rules around substance use and violence and things like that. But when clients are off the property, clients are off the property. Residents are encouraged to do 6 hours of service weekly, and that would be being part of the guard shack duty. So making sure residents are signing in, visitors are signing in, signing out. People are following the rules, doing the rounds, writing incident reports. We also have landscaping, bathroom cleanup, sorting donations as part of that service, giving back. We keep an up-to-date roster that we share with staff on Google Drive so that, let's say, fire department goes out and says, I've heard that there was an issue with tent site 17. Can you give me information? I can look that up quickly from wherever I am and make sure that we can use that information to assist. Average number of people and length of stay. Our last fiscal year, we had over 11,014 hours that people had logged in the work that they were doing that my staff was overseeing. We also use that for our funding leverage for our HUD Continuum of Care grants. Our average length of stay is about 59 days. That said, we do have people that stay longer. We don't have a time frame, and we've gone back and forth on that, but it has continued to work for us in that capacity since 2011. And last fiscal year, we served 234 people at Camp Hope. So the ways that we provide for the camp, we have an annual fundraiser that's called Tents to Rents, and it's to illuminate the idea that we have people living in tents. We want to move them into paying their own rents, or even in a housing program where they are paying rents instead of living on our streets in a tent. We have HUD coordinated entry housing programs that helps me to pay for my staff to provide those supportive services and housing offers. Social Security disability, again, SOAR staff that helps apply for those applications. We have VA funding, supportive services for veteran families. So we have a lot of assistance for our veterans. And we received a lot of state legislative funding, capital outlay improvement program funding to upgrade the camp to make sure it met all the zoning designations. Some of the unintended consequences of instituting Camp Hope: the camp resident camaraderie. People were encouraging each other to sign up for housing, to go into housing. Many will come back and provide services at the camp even after they move into their own housing unit. We saw a huge rise in donations. It really brought the visibility of homelessness to the forefront for our community. There were a lot of school, church service projects. We built Project Dignity, which was the outdoor kitchen and bathrooms I talked about. One of the things that's ongoing is trying to instill that spirit of the camp, especially as we continue to make improvements. And again, our main goal is to continue to house folks. The things that we feel like we did right, we did ask our city permission first. We gave, as we rezoned, we gave business partners and residents opportunities to weigh in on what they would like to see. And of course, we use the voice of our residents and what they would like to see as being a safe outdoor space. We provided the infrastructure, elected camp management, provided the supportive services and that connection to housing. We use a trauma-informed care model, and we continue to have weekly regular meetings at the camp with the residents and the safety team at the camp. And these are just a few graphics to kind of give you an idea of the outlay of Camp Hope and part of our site plan that we use to submit to the city of Las Cruces to get it approved. We've had projects from Home Depot who helped us build these tent structures to surround the tents, just to provide additional barriers from the elements and prolong the life of the tents. It's just a snapshot of the agreements. We have changed these over the years as needed. Again, always implementing the input from our clients. The registration form is very simple to get into Camp Hope, but everyone has to register. Again, it then goes onto that shared Google Drive, and then they will undergo an actual full-length intake with staff at another date. But just to get in, we are getting the bare bones information that we need. We did garner some national attention from instituting Camp Hope because it was so early on. We've seen a lot of communities grappling with what to do with unsanctioned tent cities. And then especially as many communities are impacted by COVID, I've been able to talk to a lot of areas that are considering having a safe outdoor space in the form of a camp. And that concludes my presentation. So if you have any questions, I'd be happy to answer those for you.
Thank you, Nicole. Thank you so much. That was a incredible presentation. Thank you. And you were very efficient in your time. Appreciate that. You've clearly done this presentation a few times, I think.
Yes.
Thank you very much. Madam Clerk, can we get the regular screen back? And we'll pop this back up if members have specific questions about certain slides. Okay, I see everybody's faces now. Members that have questions, Member Lawson.
So Nicole, number one, awesome job. That's pretty cool. How much land do you have for the 50 residents? How much acreage does that entail?
I get asked that often, and I keep meaning to go look back at what that actually is from our final site plan, but it's a couple of acres. We do have 45 tent pad sites, even though we can have 50 people, and that's because we do have some couples. And all of the tent pad sites are spaced at least 10 feet apart, as was designated from our fire department. And so if that gives you an area kind of the layout of how we decided how far to spread people around.
The slide was kind of hard to see, but it looks like the pad is 12 by 12.
It is 12 by 12. And all residents have to keep everything on that 12 by 12. There's also in the middle of the camp a big turnaround in case a fire truck needed to come in, and they have full access to turn around there.
Nice, very nice. Thank you.
Thank you.
Yeah, that was a lot of really good information and a lot of questions that were answered. And you've clearly been doing this for a long time. So I think we appreciate you coming and giving us this information. I'm not sure that we all got this slide deck in advance, did we? I don't remember when I was printing stuff out.
No, but I can send it.
Would you mind doing that? It's just because there was a couple of slides that were really, they were hard to see, and I know that they contained incredible information. So thank you.
Happy to send that. I'll send it to Cynthia Esparza, has been my contact, so I will send it to her.
That's perfect. That's perfect. Member Dare.
Yeah, some of our concerns that we've heard since we've talked about this in the beginning are around some of the habits or vices that those are homeless in this situation find themselves in. So is this something that, from drugs to whatever, is that a problem on the campus? I'm just straightforward. This is the thing we hear of some of the concerns, is that we're going to bring in and kind of create something that it's almost potentially a more difficult problem than we already have. And I don't necessarily believe that to be true, but it is a fear. And so can you speak to that, so we just kind of get that understanding of how do you handle that, or do you, or what's the thought on that?
Sure, I appreciate that question. I can tell you that when we started the camp in 2011, I was the housing programs manager at that time. So my job was to get people into housing and not into tents. And when the director said, this is what we're going to do, I was like, I'm not so sure about that. That sounds not great. 2 weeks later, she left and I became the director. And so those were some of my concerns. Are we just grouping together people that might have some big behaviors, have some addiction issues, some hoarding issues? Those are all things that the people have, whether they are in a camp or not. So those are already issues on your streets. It's just how are you going to deal with that when you're working with people experiencing homelessness? So again, we have a harm reduction model, meaning that everything is low barrier. We don't require that people have to be sober to utilize the camp. However, we are on city property, so we are beholden to certain regulations. So if somebody is actually physically on the campus and using drugs or actively imbibing in alcohol or something else that wouldn't be allowed on city property, then we address that, and they're not a fit for Camp Hope. They are still a fit for housing. We will still continue to work to try to get them into housing. They can't stay at Camp Hope, and that's an understanding that we work with people on. So if they do that while they're here, then they are out. However, if they are staying at Camp Hope and they went to the bar all day and then they came back to Camp Hope and didn't keep drinking and passed out in their tent, that's where I want them to pass out. That's where I want that to happen, because then I've got services available to them. We can talk about what happened, but if they're not causing a problem and they are over 21, that's not really my business. It is my profession to help them with any of those addictive behaviors, but I'm not their parent, and so they can do those things off the property. And then again, we will try to use that harm reduction model and try to get them to use something else while they're off the property to try to reduce that drinking, and still try to work with them on getting them into housing. And so that's how we have dealt with that.
Thank you.
I have two questions. Clear, you instituted the camp, I would guess, because of a proliferation of encampments in other areas within your city?
Not quite, actually. This sort of coincided with Occupy. Do you remember when Occupy was a
Yep.
thing and tent cities were cropping up everywhere? So I think that sort of became our solution, but really our city was kind of not happy with tents popping up everywhere, even though it wasn't people experiencing homelessness. It was, for this more of political nature. But so they said, if we're going to target Community of Hope anyway, you do have a lot of people sleeping on your property where it's city, you can't have them camping there. And when you have congregates of people amassed anywhere, you're going to have some issues. You're going to have some littering issues, some fights, there might be drinking, things like that. And so the city just decided when Occupy came up and tents were everywhere that all of a sudden just stop. You can't have anyone staying there. But we were only open during the day. We didn't have overnight shelter or anything. So we said, okay, where would you like us to send them? You want us to send them to go trespass somewhere else? Because we can do that. They can't stay at the mission because half of them have animals. We do allow animals at the camp, although that is capped and there are rules around the pet regulations. And so the city said, well, we don't know, but just stop letting them sleep on the property. And so that's when we came up with deciding that we needed to have people close to services. We needed to have people sleeping on our property. We just needed to organize it. And that's why we developed the camp.
Have you seen a reduction in the number of camps in other areas of your city?
We have about 100,000 people in Las Cruces, so we are a pretty small community. We do still have other camps, and typically that will be people who either did not do well at Camp Hope or do not want to be around a lot of people, do not want to have any rules. We provide outreach to the camps, but really they stay super close. They're like at the end of our driveway. So we have had sometimes where we've had officers say, like, hey, there's a new camp that's way out over on the highway, and we'll send staff out there and we'll try to bring them into our area. But we've been, and this comes and goes. Like sometimes we'll have like 3 or 4 and we're like, oh no, here it comes. We're going to start having all these camps. And then we kind of bring everybody back in and meet with our city councilors and figure out what kind of an outreach we need to do. And then we don't have anything for years. And then all of a sudden, like another camp will crop up. Especially during COVID, we've seen a lot more just because parks had been shut down, our businesses had been shut down, our mission, the overnight shelter, shut down. So we just had a lot more people visible who were camping with COVID. But again, we just addressed that as that happens. But so far, it hasn't been a big issue with having other camps in other places.
So a component, and I'll shut up after this question and I'll go to you, Member Hill. So a component of your operations of the campsite is the outreach to the satellite tents, for lack of a better term, the tents that are not within your facility to try to bring them in?
It's more a component of the Mesilla Valley Community of Hope. So I've HUD funding to provide outreach and supportive services. And so I have a team that I can send out as needed.
Okay, thank you. That was very, very helpful. Member Hill.
Thank you. Nicole, thank you for this great presentation. Knowing that you were hesitant about having Camp Hope right before you started as director, if you were advising other communities about whether this is a smart move to add as a component to the Housing First solution, what would you say? Or would you say it just is particular to different communities?
I think every community needs to gauge where it's at and what their resources are. I give this presentation because I feel like we all have a responsibility to take care of our own. And if there's a way for me to share that information where communities don't have to reinvent the wheel, then I'm willing to. Because I think if it's a fit for your community, if you already have encampments, then I would say, yes, do this. I remember the director when she left and she saw what I had done with Camp Hope and, rezoned and made it something that was real and that has had longevity. She was like, man, I would have just shut that thing down after winter. And I'm very glad we did not. It has served so many people. I mean, even just having 234 people who weren't, all over the streets of Las Cruces sleeping, that we know that we kept safe, and that was a very, very affordable way to do it in a camp style. I would absolutely recommend it. It's provided that stopgap that we needed in our community and eliminated other camps in other areas. So I think that if it is something that you think your community needs and could manage, then you can. I just really, want to reiterate that you need to make sure that there is that infrastructure. I think part of the reason ours has been so successful is because it was tied to a nonprofit who already had those services in place.
Very, very helpful. That's great information. Arlo.
I just wanted to share, I did a little math in terms of the layout they're using in New Mexico, and they're at about 500 square foot per shelter. We have roughly 2 acres on the field itself at the Governor's Bowl without getting into the slopes or the parking lot. So that adds up to about 175 sites we could put down in the bowl itself if we opted to go in that direction.
Thanks for doing that math, Arlo. Appreciate that. Okay, do any members have any other questions at this time? Okay, I'm not seeing any. Again, Nicole, thank you so much for your time. We appreciate it very, very much. And I have a suspicion that we'll be reaching out to you for probably more information and maybe more detail and more collaboration. But sincerely, thank you for your efforts and your time on this. Very much appreciate it.
Thank you.
Thank you. Okay, item 10, we're going to get a board update and discussion on the status of the RFP for a sanctioned second. Kate, good morning.
Hi, good morning. Thanks for having me. Kate Thomas for the record from Washoe County. And if you'll recall, in I believe it was November, we were asked to assist in putting together an RFQ for the sanctioned camping location on the CARES campus. And so we pulled together staff to start to shape up some of the elements that we would need. It's really helpful to have presentations like Nicole's so that we can gauge, having not done this before, what other successes communities have experienced and whether we have those elements in our RFP. So we put it together kind of in line with the interlocal agreement where, because it's the CARES campus where, I mean, it's obviously the region, the cities and the county, but you know, there has to be a point person. So we have it on City of Reno letterhead or in their structure, but obviously lots to be hashed out here. Some of the pieces that are in the RFQ include the facility, whether there would be restrooms and trash. Those are the elements that we have in there. We also had a no barrier situation since that's what folks are experiencing currently. We wanted to meet them where they are. And for lots of reasons, from funding to sort of this would be that entry level location where they could progress into other types of housing. The funding is really the $1 million ticket here, right? We have to figure out where the funding sources would be. I love the idea that we're talking private sector and nonprofit mixed with the government so that we can at least come together and bring those resources in so that we can make this happen if it's the will of the electeds. The term, we know this had originally been asked as a pilot project. And so we put 3 years in there, just if you look at the previous presentation for some infrastructure. And we had guessed at about 150 tents to start with. So I'm glad, Arlo, your math kind of coincides with that. Just to sort of, you know, it's not a scenario where I think it would be successful for us to put every person that's currently camping in one location, but rather phase in and phase out folks for long-term success. And then we've got some reporting requirements, some staffing ratios, pets, things of that nature. So just so you know, we did start putting, it's ready to go, I think, to use as a draft or a starting off point where we as a region can come together and say, okay, let's tweak this, let's tweak that when we send it out to the community or to the country to bid on. So hopefully we would get somebody that's a good partner like we just saw in the previous presentation. So I think there's a couple larger questions that have to be answered. We heard a little bit from law enforcement about, you know, the need for security or whether regional law enforcement would serve in that capacity or we would hire private security, things like that. But I don't think there's anything insurmountable if we got together as a region to talk about. So that's my quick brief update on where we are with RFQ. Ready to go with some tweaks. And then we obviously have to talk about how that builds in with the upcoming need for the revised interlocal agreement and things of that nature. So happy to answer any questions.
Kate, I guess my first question would be, when do you think that draft will be distributed?
It's the managers all have it. Sorry.
Oh, the managers all have it. And then would that be coming back here before it went out, or would it just go out from, I've not seen it.
Right. Well, I think there's some work that needs to be done, talking to law enforcement, talking to, fire department, things like that, to make sure the elements are in it. As far as reporting and so forth, just everybody agreeing that we're going to use, X reporting methodology, whatnot. So my recommendation is that staff gets together in a room or distanced and kind of hones in on the elements, talks through some of it to get it to a point where it's ready to let. I know statutorily we have to have a funding source before we open up an RFP. So there's that discussion that we have to have. But otherwise, I would leave it up to this body to decide whether or not that it's ready for prime time.
Okay, so it would come back here before an actual distribution.
It's hard, right? You don't want to, you're doing an RFP, you don't want to tell everybody all the elements, but yet you should, because we want to develop them together. This is a new path as a community that we're taking. So I think that once we know there's consensus that this is the direction we're moving, and where it fits in the interlocal, it's pretty ready to go. So I think it's just a series, maybe some work by staff in advance, and then in front of this body would be my guess.
So, okay, and that's what I'm trying to understand, because and how this all ties with the Nevada Cares Campus, or is it more of a, because it is kind of a pilot, but you want a little bit of a level of certainty even to a pilot, because people don't want to dedicate a bunch of resources if they know the next year it's going to go away. I'm back to the private sector discussions again. So I'm just trying to better understand the timing of it, and then also timing the discussion of these camps with some of the, which I know you guys are doing all these discussions as well, with the group we're planning on meeting with in mid-February, the service providers, the advocates, and kind of those folks that, boots on the ground folks that really kind of understand what the needs are. And a question I didn't ask Nicole that I should have is, what was the carrot to draw the individuals, let's say, away from the park or the river or the downtown into this more structured, supervised camp site? Because that to me is probably our biggest barrier, is, again, and I'll say it, I've said it before, is doing this with our houseless neighbors, not to them. I mean, we want this to be something as kind of the first rung on the ladder to getting to the next rung of, maybe that is the 46,000 square foot structure. And then from there, it goes to supportive housing, and from, those sorts of things. So I'm just trying to understand the timing of it, and when we get our eyes on it, to better understand what's in it. So.
Great. Well, we will prioritize that, get everybody together to hone in on it. It was one of those things where we've been talking to folks like Grant Denton, who's talking to these individuals on the river to try to gauge the interest of, let's say we were to allow you all to stay together in a different location, does that work? And what we're hearing is that people want to stay with their little community that they're camping with. I don't think so much the location is really, but rather that they're together and that they're safe. So if we can remove some of the barriers that they're currently experiencing, which is constantly being worried about being flushed from their existing location, and security of their things getting stolen. I mean, if we offer them that carrot that in this location, there would be, facilities, you'd have a little bit more secure facility usage as far as restrooms, and not being worried about, being flushed out every 5 minutes because you're allowed to be here. We actually want you here. So I think those things tee us up for success as far as the camp is concerned. And we're hearing from folks that would be willing to relocate there, especially if there were some services. So like I said, a couple of things we have to hammer out. And I think rather than using an enforcement arm, I think it's that communication arm with the existing service providers that we have that will make this successful.
I tend to agree with you on that. And thank you for your efforts on this, and, for being the lead and helping to get this out. I think that's important. And thank you for that. Member Dare.
Yeah, just a quick question regarding some of the possible funding. Is there any hopes to see some HUD or Medicaid, or this is a new infrastructure piece and there might be, have we been able to look? Can we try to look? I mean, obviously we all are very aware of what we were talking about here and what money we have and don't have. But it would be so helpful if we could see some potential help come alongside some of these efforts, especially because how HUD sometimes works is you get different credits for different things you do or don't do. I don't know if this is one of those lines of credit where they'll give you something for doing something like this. So I don't know. It'd be great to know what options might be there. Thanks.
Well, I think a bigger picture discussion is warranted, just given what we don't want to do is go out and say we're chasing down, HUD money for the sanction camping, and so is the men's shelter location. So I think we have to coordinate as a region as far as holistically what we need for the CARES campus, and then figure out which piece needs what resource and what's available.
One final thought. I'm sorry. So who is doing some of the potential looking for some of these options? Is that something you guys are working on? I know seems like a good idea that we all know we'd love to find that treasure chest somewhere. But is anybody actually working on this?
I was not at the meeting. I had a conflicting meeting last week, unfortunately, for that fundraising effort. But I know the managers have been discussing amongst themselves kind of, where the lead comes, how does it tie into the interlocal, what does it look like, globally for all of this. So I think we're all circling the wagons. I don't think there's been a dedicated, Kate Thomas, you're responsible for finding funding for X, Y, and Z kind of thing yet. So I think those discussions need to continue to be shaped.
Thank you.
Arlo?
I wanted to add, there are some HUD funding opportunities out right now with a very short timeline to apply. I know we put in some to help with the shelter improvements, and I asked our team to make sure Sparks and Washoe were aware of those. My understanding is it's additional COVID supplemental money that's being administered through the state. So I believe the deadline is Friday to apply, so we don't have the benefit of time for this round. I'm assuming the other entities are also putting in for that. We stayed away from the campground in terms of our application, focusing on helping with some of these shelter improvements. So if anyone's not aware of those, Monica has all the details. We should all be putting in for that money.
Totally agree with that. And here's the thing, and someone correct me if they think I'm wrong with this. So the construction of the 46,000 square foot structure and the development of the Nevada CARES campus is going to be a longer term sort of involved process in my mind. It's going to be more complex. The campsite is something that to me is almost something we could facilitate sooner rather than later, understanding that we don't know what we don't know. And not that I want to just do something to be doing something. And I think we're hearing some level of structure that can be successful for the longer term. But in order for the facilitation when businesses reopen and things start to come back to our communities, to effectively clean some of the areas along the river and in the parks and our downtown, and having a location for them to be in it before the campus is actually quite developed. And so I just wonder if this concept of included but maybe not completely for the camp could be like a side letter of development. I don't know. I'm just trying to understand. That's why I was trying to get at the timing of the RFPs and how that times with the overall operations of the Nevada CARES campus and how they're tied together or not. Because I see the camp kind of being the first step towards getting folks into the longer term housing, but not the long-term solution. I don't think tents are appropriate for the long term at all. But I do see it as potentially an effective first step, but I just kind of was trying to understand. Member Lucy.
Thank you, Madam Chair. I think the discussion is going in the right direction in regards to where we need to be in regards to these individuals that are experiencing homelessness. But I want to make sure that as a group, we understand there are going to be different levels of attention needed for these individuals. And I think like you're pointing out, the tents are maybe not the long-term situation. However, they are that immediate low barrier situation that provides us that ability for our caseworkers, our community, everybody to contact these individuals. So I think when we talk about immediate needs, I think that Safe Camp is an immediate need that we have to kind of congregate the individuals, provide them with a cohesive group of resources, and then discuss that transition into intermediate housing, or and I think that is one of the programs that we're working on through Built for Zero. That's the discussion that I know I've had with Kate, our Assistant County Manager Thomas, and Executive Director Howell multiple times about how do we transition through this process. And I think Ms. Searcy is going to bring that forward with the Built for Zero once we get more of that data and realize this stuff is not going to happen overnight. But as long as we keep moving down the process of getting these safe camps online, I think that's really going to help us in the sense of congregating the individuals, those that are not service resistant, giving us that access. And I think that's been what we've seen here, tremendously beneficial. I think Ms. Martinez pointed that out in Las Cruces, that it was beneficial for them as well. And it's that slow migration, because you're not going to put these individuals right into a housing situation right away that they're going to be able to be successful with. But this is that stepping stone, that gradual process. So what we can do to identify the funding sources needed to move forward with that is going to be the greatest benefit, so that we can get those online sooner rather than later. Thank you, Madam Chair.
Thank you. And all valid points. And I appreciate everybody's support on trying out these sort of new to us efforts and doing the work to see where they've been done or not done in other locations, so that we do this right. I mean, I think we took just a Herculean step when we all came together to get the 15 acres. And that is so far ahead of where other cities start. Every group that I've talked to said, you mean you've already got a location and you already have a main structure? You are light years ahead of where they had started. So kudos to everybody for working together. And that's the only way we're going to do this, is if we continue to work together on these efforts. So I appreciate everybody with regards to this. Okay, do we have, Member Lucy.
One more comment really quickly too. The other thing though, and I don't want to lose sight of that, Mayor Lawson brought up previously as well, there's got to be some accountability and some skin in the game for these individuals, because if it's always so low barrier, and there has to be some standards there for these individuals. And I understand the intent is to continue to provide shelter and housing for these individuals, but if we don't help migrate and have some accountability there, they will never get them off of first base. We need to help them down through the process. And I don't know if there's ever a strong enough caseworker or an individual to help certain individuals motivate out of a situation. And so we need to help do that. And I think through that is accountability as well. So some simple barriers and rules established, some services that repayment of cost, helping identify Medicaid costs, some different things like that, educational funding, access to healthcare, those kinds of things. Those have an expense. We can fundraise for that, and I'm happy to help fundraise for that. But there also has to be, both parties have to have some skin in the game, so to speak.
I totally agree with that. And I think we can point to some local programs that are examples of that. Your Crossroads program has incredible accountability and has great outcomes. The Reno Works program had accountability and had great outcomes. Grant Denton has accountability and he's having very good outcomes. So I think you're absolutely right that you have to, it needs to have some of those goals and those rungs that you're reaching for, and that moves you out of the place in which you are into a better place. So I agree that's very, very important. So thank you for commenting on that. Okay, any other members have any questions or comments on this at this time? Okay, seeing none, we're going to move on. We are on to item 11, board member announcements and updates, including future agenda items. Member Hill.
Thank you, Madam Chair. I just thought, since we're talking about uncertain timelines and we're looking at budget uncertainties, perhaps we need to move forward with putting an agenda item on the county taking over the continuum of care for these items, because I think that that will help create a lot of clarity. I know that the managers are working on this, but perhaps it would be an appropriate thing for staff to put down a timeline, how we want to do that transition, have that transparent to the community to see that we're really moving towards these goals.
Thank you. I think as you look to all the steps we need to be taking, that's just a hugely critical one that all things sort of link to. And is your concept of this kind of all encompassing, the shelter operations, all of it?
I'm thinking so. Yes, I think that is what the commission on January 13th at our strategic planning session committed to. And I think, just seeing that, we're at such a crucial point in this process and we've come together so well as a community, I think that this is the next logical step.
Thank you. Okay, so that's a future agenda item. Okay, any other members have any future agenda items? Member Lucy, did I see a hand go up? Yes.
Thank you, Madam Chair. A couple things I did want to bring up. There had been some discussion, kind of member comments on an agenda item in regards to this last week with the weather, the inclement weather we've experienced here and some challenges that we've seen. Obviously there was some social media outreach by Rise, our operator at our place, that was able to raise funds for the individuals that weren't housed during during the snow last week. And I want to point out and make sure that it's on the record so that everybody has a very clear understanding. Washoe County, to the Human Services Agency, we have had a motel housing program for individuals since November, and have been housing individuals through that program that would not could not qualify to be in our place or whatnot. We've housed over 150 people in motels during that time, since that time, and currently we have 53 individuals in there. Now, this is kind of an emergent trend option that we utilize at the county to make sure people are housed, and so I want to make sure that's very clear. We do that and have been utilizing that. However, it's a very costly option for us, so that's why we want to continue to work towards programs like the Safe Camp and Our Place and the expansion of those services. But and we're very fortunate that through those opportunities that we had with the state, that we were ultimately able to open House 8B at Our Place. So currently, all the families that are currently registered or that we understand are experiencing homelessness are not have not gone unsheltered. And so we had those extra 15 beds become available at Our Place just recently at the end of the year, and now are in full operation. So just want to make sure that's on the record and very clear that we are doing that, and we continue to work on those emergent issues for the families that need that or individuals that need sheltering, whether they're at Our Place or in a motel, but we are doing that. So I want to make sure that that's very clear with everybody. Thank you, Madam Chair.
Thank you, and thank you for getting that out there, because I think there was, and back to my communication point, I think there was some confusion as to who was doing what behind that effort, or how it was being facilitated, and how it, the other things that I know VOA had a winter sheltering expansion plan. I know there were some other efforts, and I just wasn't sure how the Rise fundraising connected with your motel placement program. Was it just an extension of it?
Well, since we're not really agendized, I don't want to.
Oh, I apologize.
But I will say this: it is a program that HSA has had to identify those individuals that need it and have contacted us, and so we'll get them into a motel immediately. And since we've kind of migrated away from the tent opportunities at the Record Street over the last couple of years, and now we have our place and whatnot. We're looking at new strategies, and I think that is part of it. It's just not going to be an overnight situation, so we can house everybody, and we've seen such a growth. And I think Ms. Searcy pointed that out earlier in her presentation. Actually identifying these individuals. So as we continue to identify people and those that are experiencing homelessness, we will continue to help them in ways, in any facet we can. But that motel program is one that we utilize. It's just an expensive model that we don't necessarily go to. So we want to see if we can get them one into our place, Record Street, CAC, something of that nature first. And then if we can't, we will move them to a motel situation on a temporary basis until we can move them and transfer or move them to a different program.
Thank you. Thank you for that. And this will be my agenda item for the region to work together. And Mr. Thornley knows kind of what, at least where I was kind of coming from on the efforts that our region has been working on as it relates to our houseless population, and in a digestible, visually digestible way for the community at large. We here look at lots of spreadsheets and numbers and data, but to push that out to the community at large is probably not the most effective communication tool to let folks know what we are doing and how it's all kind of tied together to help our houseless population. And I do think we've done it before. We did a video for the Reno Works program, but I thought was a summary of what its impacts were and what was being done there. And it was well done. And I think we just need to look at this group regionally, putting something similar together. So when the events like we just had this last week occur, and there's this perception of, it doesn't appear that there's urgency to what's happening, when in fact there was urgency and lots of folks working to help those in the winter storm. We just need to do a better job of communicating all those efforts and how they're all tied together. So I'd like that on a future agenda to see what that might look like, or a draft of what it would look like.
Madam Chair, can I ask for one agenda item as well for a future meeting? You know, we've talked a lot about immediate and emergent sheltering, but I think one of the discussions that we have been lacking, you know, but has been ongoing, you know, with the Hope communities and different, that intermediate sheltering, you know, that true transitional sheltering. One community that I keep bringing up at the commission is the foundation communities in Austin, Texas, that do a phenomenal job of true individuals that have minimum or maximum minimum income requirements to get into transitional housing. But these are communities that are built in Austin, Texas, that offer access to healthcare. They offer access to financial services, a number of different things through their communities. And so something of that nature, so we can maybe start working towards, instead of just building all these immediate emergent sheltering, that we're helping those individuals that may be in those safe camps or in our centers into that transition, that next step of transitional housing. And I think that's where individual groups, organizations like CHA and RISE and HOPES can help us transition these individuals into that next step. So I'd like to have a conversation about that and how we can bring in the private sector to help us with that.
Perfect. Love it. Okay, any other members have any items, future agenda items? Okay, seeing none. We are now to item 12, public comment. And Madam Clerk, can you remind anybody that may be watching kind of what the public comment process is, and how that ties to open meeting law and how we can't just pull people in to comment?
Yes, Madam Chair, based off of the existing emergency directives from the governor, our process for public comment at this time is that we have public comment available through multiple facets, either by way of sending an email to cityclerk@reno.gov, leaving a voicemail as posted on our agenda, or submitting an online public comment form. All comments that are submitted to my office before 4 p.m. the business day preceding this meeting will be submitted with the item and sent to the board for review prior to that item being opened. Any comments that are received after 4 p.m. will be submitted to the board as they are received, so they will be allowed to review them prior to us adjourning. We'll go in closing public comment, which is this section at this time. Based off of that existing practice, those are the best ways for everyone that their comments are on the record and that the board has reviewed them. At this time, Madam Chair, we have no public comment that was received either after 4 p.m. or during this meeting. So you may transition to your last item.
All right, thank you, everybody, and thank you for all your efforts. And our next meeting is going to be, sounds like another big one in the many, many steps we have to evolve the Nevada Cares campus, and I'm very much looking forward to it. With that, may I get a motion to adjourn?
Moved.
I have a motion
Second.
and a second. All those in favor say aye.
Aye.
Aye. Any opposed? We are adjourned. Thank you, everybody.
Bye. Thanks.